Are you somebody that's dealing with heel pain? Well, stick around, watch this video, and I'm going to give you 3 simple exercises that you can start doing today in your own house that'll drastically improve your symptoms. Heel pain sucks. It can be very debilitating. I see it all the time in my office. It's most commonly caused by a condition called plantar fasciitis. This is just medical jargon for heel pain. There are other reasons for heel pain, but 98% of the time it's plantar fasciitis. Plantar fasciitis is basically a band on the bottom of the foot that's inflamed. So let me draw for you guys and we'll make this video interactive. Now, I'm gonna warn you, I am a terrible artist, so please forgive me for my artwork here, but I think you'll get the gist here. So this is gonna be the side of your foot and ankle. Okay, this is the side. Okay, great. Sorry, I know it's not a very good foot. This is the side profile though. These are your toes right here. We'll put toes. This is your heel bone. Just in case you forget this is a foot, we'll just do this. All right, this is a fabulous side profile of a foot. This ligament starts in the bottom of the heel bone right there, and it sort of fans out towards the toes. These red lines kind of depict that. Okay, it starts here and it fans out to the toes. But the pain for most patients starts right under the heel bone, right there. Very painful. The number one symptom that I hear is that when the patient takes their first step in the morning, it's the most excruciating pain. They feel like this ligament is tearing or it's pulling, it's very, very stiff. And sometimes the patient will drop to the floor because it's so painful. But good news is today I'm going to give you 3 exercises that you can start doing today in your home that'll really help your symptoms. So let's talk about them real quickly. This is the runner stretch. You'll come up against the wall, put your hands on the wall, place one of your legs back and straight. You'll be doing this for both sides. And then keep one leg forward and bent, making almost like a right angle. You're gonna push really hard against this wall. Simultaneously, you will try and keep the heel of the leg that is back down to the floor. You wanna push really hard like you're gonna push this wall down. You should feel a really nice deep stretch in the back of the calf muscle. You'll do this for 30 seconds. 30-second hold and then switch legs. So do it 5 times in the morning, 5 times at night, and then for extra credit, you can do it at lunchtime too. So this is one of the exercises that you can do while watching TV. You need to put initially a water bottle into the freezer, let it freeze overnight, and then every night while you're watching TV, sit down in a chair, take the water bottle, put it on the floor, and then you want to roll out the foot that's hurting the most. You just go back and forth. You can do this for about 10 minutes, just like that. Just like that. You can take breaks if you need for about 10 minutes. Okay, so this is your last exercise, and the cool thing about this is you can do this while watching TV, like the one we just talked about. So what you'll do is take the foot that's hurting and put it in your lap, like this. And then just take your thumb, and what you'll do is take your other hand first, take your toes and flex them back, and then take your thumb and then massage into your arch like this, very nicely. Go ahead and massage just like this, and what this will do is it'll promote healthy blood flow to your foot, to that ligament. It'll help break up any scar tissue, and it'll just loosen up the ligament and make it feel better. Do this every day. If you can do this for the next few weeks, you're going to see significant improvement. I give these exercises to all my patients that come to see me for plantar fasciitis. It really works really, really well. So there are other modalities that we utilize for plantar fasciitis, one of them being injections. And we utilize what's called a cortisone injection or a steroid injection. Some patients are very inflamed and very painful to the point where they can't even walk. And so what we'll do is we'll get them relief right away with the cortisone injection, and we're literally putting cortisone right at the source of the pain. Second thing that we'll sometimes utilize is physical therapy. It's formal therapy. I'll send them to the therapist. The therapist will go through various exercises, including the ones we just talked about today. Usually a program can last 4 to 8 weeks. We sometimes will utilize a boot they're called cam walkers or a fracture boot. It allows the patient to stay mobile at the same time, relax that ligament, and give it time to rest. We also utilize orthotics or inserts. Orthotics are kind of like braces for your teeth, but for your feet. So you have crooked teeth, you go see an orthodontist, he or she will slap braces on your teeth, and over time your teeth will become straight. Kind of the same idea with orthotics or inserts. I'll prescribe you an orthotic, you'll put in your shoe, it'll help correct what subtle deformities that we have. The only thing is that when you pull your foot out of that shoe for the day, your foot kind of goes back to what it used to be. And then lastly, there's surgery. And I always tell patients 95% of heel pain can be healed with what we're talking about right now. It's 5% of patients that may need a surgical procedure. And if you need that surgical procedure, it's pretty minimally invasive. And as you guys have gotten to know me from my first 2 videos, I do pretty much all my surgery through a minimally invasive technique. Very, very tiny incision that I make. I release the ligament from the bottom of the foot that's causing you issues, and you walk the same day. But like I said, the stuff we talked about today, 95% of the time will help you. All right, guys, so there you go. I just gave you 3 quick exercises that you can start doing today. Try them out. Let me know if you have any questions. I'll get back to you. Thank you.